been anywhere between about 46 and 60 or 60 some odd long-term care homes in what we're calling large outbreaks. So a large outbreak is more than 10 staff and residents infected. And so we surveyed through homes. We ended up getting 88 staff responses. This is from mid-November to yesterday. From staff who are working on the ground in the homes with these outbreaks. So, and the range of size of the outbreaks covered in our report are about 35 to 40 residents and staff infected, all the way up to more than 150 residents and staff infected across more than 30 of the homes with large outbreaks. So we think that it gives a strong sense of what the conditions actually are on the ground in the long-term care homes where COVID is spreading. And what we found was really, in some ways a surprise, some ways not a surprise, but it should be. The basic question we asked a few questions that were yes or no questions. And then we asked for kind of open-ended responses so that they could answer in their own words. And we limited it to no more than 3 per home. A number, we got 1, some we got 2, some, so that we weren't skewing it towards any one particular home. So we eliminated a bunch as well. And so in terms of staffing being vital because there is no care without staff, what we heard was that 68.8, so almost 69% of the homes that we surveyed, these homes that are in large COVID-19 outbreaks, were reporting that they're short-staffed. A very small percent of them, 4.2% of that 69%, said that it's sometimes. The rest indicated that it is routine. We asked if you're in contact or exposed to residents with COVID-19, do you have N95 masks and full PPE? 25%, so 1 in 4 of the staff responded that they do not have full PPE. We asked, so these are, homes with COVID-19 outbreaks now. We asked, are all COVID positive residents separated from those who are COVID negative, which the homes are required to do? So about 80%, 79% said that they were, and the rest said that they weren't. Some said that they were at first, but as the outbreaks got so bad, they weren't able to do it anymore. It sort of fell apart. They didn't have enough staff to do it, and they weren't able to do it. We asked a second question just to get at this, because in some homes we had heard that they are cohorting the residents, but that there's no one to stop the residents from wandering into COVID hot zones and getting infected. So we asked that specific question. Are there enough staff to stop residents from wandering from COVID safe areas into COVID hot areas in your home? And 37.5% of the staff said no. 25% said definitely yes, and the rest didn't know. We asked if they are locking residents into their rooms or using physical barriers, because they resort to that when they don't have enough staff. We asked, and I'll get to the details on that in a minute. We asked, are staff who are COVID positive but asymptomatic required to work? And I was shocked at this. Almost 15% of them said yes, that COVID positive but asymptomatic staff at this point in the pandemic are still being required to work. And they're not working on work isolation. They're working on the floors as PSWs and nurses. And then we asked them to describe why they thought COVID-19 was spreading in their homes. Just to give you a sense of what the answers were to some of these questions, I'll just run through fairly quickly. When we asked about the PPE, staff described having to, when we asked about the staffing, staff described, having worked 14 days in a row, that residents are missing showers. There's agency staff in, but they're not trained. They describe working on their days off. Some are doing 12 and 16-hour shifts. No time for breaks, even in those shifts. We've recently become infected with COVID on the wandering floors. We're working with ridiculous levels of staffing. You know, one registered with 2 or 3 PSWs for 32 residents, with more than half of them infected with COVID-19. On my night shift under a COVID outbreak, we should have 2 PSWs on the shift. There's only one, me. Out of 16 of the residents, 1 has passed away, 4 are confirmed COVID positive, and 10 are symptomatic. It's overwhelming for only 1 PSW to manage. I can't give efficient services to 3 or 4 residents who need immediate attention. They talk, nursing staff was okay, but they're short-staffed in housekeeping with only someone available to disinfect high-touch areas and dispose of trash. These are in homes with large COVID-19 outbreaks. I find this unbelievable at this point in the pandemic. They talk about they have 1 more PSW than before, but due to isolation, so all the residents are isolated, there's additional work. It's making them short. Support workers are no longer entering the COVID positive wards, and PSWs, that's hired in support workers by families, and PSWs have to do their work. Feeding and isolation takes longer. They talk about working without days off for long stretches. I'm humbled to have help. However, agency workers were not COVID tested prior. When the agency workers were finally tested, they had positive results. And went for the cleaning company they brought in to help, PPE was not ordered for them at the onset of the outbreak, and so they were deployed without PPE. They talk about just extreme staffing shortages in a number of the homes that clearly mean, even in the COVID wards, that people, there's just no way that they could get enough care. And the staff are bridging the gap by working double shifts, back-to-back double shifts, working through their days off. They're called in all the time and not able to provide the care that they know the residents need. In regards to the PPE, there were so many stories about not being able to get PPE that, you know, it might exist in the home. In regards to N95 masks and full PPE, they're discouraging us from using them. We're being told to use the normal masks, and the gowns that we're using are industrial gowns, not medical gowns. We don't have personal access to the masks. The masks are locked in the manager's room and are only given on request. They're being told that they don't need N95 masks in homes with COVID outbreaks. Even the staff who are dealing with COVID positive residents, they're telling them that they only need N95 masks if aerosolizing procedures are being done. That's happening now in the homes with large outbreaks. It is not a shock then that COVID-19 is spreading through those homes. When it started, we had no N95s, but when it spread like a fire, then they provided the N95s. No, we don't have N95s. We have the other PPE. Staff talk about not having time to change their PPE between residents. They talk about having shortages of other things, not just N95 masks, but also gowns and gloves and hand gel, disinfectant wipes, and a whole range of PPE. When we asked them about cohorting the residents, a number of them, so a sort of shocking number of the homes actually hadn't cohorted the residents. And then in some homes they had tried, but it had fallen apart because they couldn't carry on as more and more people got infected. So we asked them, you know, are you locking people in the rooms to keep them from wandering? And a number of the homes, they said that they were actually locking them in the rooms, or in some cases putting their wheelchairs in front of the doors so they can't get out of the rooms. Horrifying to us, they talked about in a number of the homes taking away the residents' wheelchairs or walkers so they can't get out of bed, so that they can't wander. But that's an egregious human rights violation. I mean, there shouldn't be a situation where there are so few staff that you just leave the residents in bed all day with no way to get up and get out of their beds because there's just a critical emergency staffing shortage. Anyway, I hope I've given you a picture of what's happening in the homes. You have the full report. The link is in the in the chat there, and it's up on our website. And without taking too much more of your time, I'm going to hand you over to people from the unions, including a frontline worker here. And I think there's one other joining us who are working in the homes right now, to just tell you what's happening in the homes. So Ricardo McKenzie, he's the Director of Long-Term Care for SEIU. Ricardo, do you want to go ahead?
Thank you, Natalie.
Thank you.
As Natalie stated, I'm the Director of Long-Term Care at SEIU Healthcare. We represent approximately 23,000 members in nursing homes. During the first wave, a lot of our homes have been hit by COVID and has been hit severely. Now in the second wave, it's even worse. We are seeing a lot more of our members who are falling sick to COVID. We have several homes in outbreak, and I'll tell you about at least two of them that, in my opinion, are severely in an outbreak situation, and the staffing level is really at a crisis situation. It is horrible in these homes. And the homes that I'm telling you about is Grace Villa. Grace Villa in Hamilton. That home has approximately 184 beds. And the last numbers I received from the folks at that home is approximately 173 residents who are infected with the virus. So almost every one of the residents got the virus. Cohorting is very difficult, especially when folks are working with a skeleton number of staff. It's like you had people who normally work on a shift, 4 people on a shift in the night, they're down to 1 person on the shift. They are short of PSW. They have not, staff have not been able to take time off. They have not been able to take their break. They're tired. And they're saying to us that, look, what can you do to help us? They have asked us to call and ask for the Army to help out, and we have done that. We recently learned that Hamilton Healthcare Service will be providing assistance to the home because management have definitely lost control in keeping the virus at bay. So it is a crisis situation in that home. We have approximately 58 staff who are infected at that home. That's the last number I received. 100, and I said approximately 73 of the residents that are infected. You have 21 deaths at that home. And another home that I will speak about is Rivera West Side. Rivera West Side, that home on November 12th, they had approximately 141 residents who were infected. They had about 112 staff infected, and they have at that time about 20, I don't have the exact number for the deaths that were there, but it was in the 20s. Today at Rivera West Side, we learned that they have done a better job in trying to contain the virus. They're now at 55 residents that are infected, but in terms of the number of staff, they have 94 staff that are infected, and 25 deaths. So it's 25 deaths. That's the number we got from them for Rivera West Side. We have asked for the government to take over management of both Grace Villa and Rivera West Side. At Rivera West Side, it's another private company who has taken over management of that home, and not necessarily one of the hospitals. For what reason, we're not too sure why it wasn't a hospital. It was a private company that has taken over management of that home. So it is a crisis in the homes. Our members are talking about agency staff who are coming into the home to help them, but unfortunately, agency staff are not properly trained. They're not properly trained in lifting residents. They're not properly trained in giving care to residents. So as much as they're there to help, there's not much help that they're given because they're not properly trained. So the issue about the shortage of staff is horrible. It is horrible that folks, they're tired, they want to have days off, they're holding the ship afloat, but unfortunately, they're very tired. N95 masks, as Natalie stated earlier, we have employers who are discouraging our members from using N95 masks when giving care to infected residents. They're told that it is not necessary. The surgical mask will provide the same type of protection. So they're discouraged from using N95 masks, and in some cases, they're not provided with N95 masks. So that's, in our opinion, it's part of the reason why the virus is spreading. We have recently asked the employer at Grace Villa, as our members have requested, to test the ventilation system, because our members, they think that the virus is traveling through the ventilation system at the home, because they just don't understand why is it spreading so rapidly across all the units in the home. So these are the stories that we're hearing from the members. I would pass it on to back to Natalie, but it is horrible in these homes.
Thank you very much, Ricardo. It's hard to hear. And we'll open up for questions and answers just in a moment. We have two other speakers. Andy Savella is the Director for Healthcare for Unifor. And they also had members in the homes with large outbreaks answering the survey, and he can describe to you the conditions in those homes. Go ahead, Andy.
Thank you, Natalie. And I want to start by just saying sincere thanks to the media that have joined us, because it's going to take us all, unfortunately, to motivate our government to put immediate measures in place, immediate resources, much needed immediate resources in place, particularly in these homes that are an outbreak, because the stories that are coming out of them, you know, are frankly just absolutely horrific. We've, you know, not just through the survey, but in talking with our staff in these facilities, and frankly, we've talked with a lot of families who share these same concerns. They describe, you know, a scene inside the facility that can only be described as absolutely horrific. You know, as Ricardo said, you know, you could walk into a facility, go down a hallway and essentially see, you know, no healthcare workers, because the facilities are so short-staffed. There's so many staff infected that there's frankly nobody home. And so they don't have the ability to cohort positive residents and not positive residents. They're, you know, able to move back and forth, often, you know, touching things and communicating with each other. You know, I'm sure people are aware that these residents aren't wearing any type of mask, but you know, sanitizing, infection control is a huge problem too. I know in one major outbreak we had in a facility that houses about 185 residents, they had 4 housekeeping staff at one time available to them that were working 24/7 for days on end, trying to keep the facility clean and sanitize it to prevent the spread of the virus. So infection control is a huge problem, sorry. And, you know, frankly, residents are left, because of lack of staffing, not for lack of trying, unattended. Many times they're unfed. You know, obviously the requirements for their personal care and their health care isn't getting performed because there's no staff able to perform that work. And we also are experiencing problems with staff being able to access appropriate PPE. Some employers, and I'll be quite frank and honest, it's worse in the for-profit sector. There's problems with people having access to PPE. And what we've been learning, particularly over the last few days, is that, you know, the Directive 5 from the Provincial Medical Officer of Health provides that any healthcare worker within 2 meters of a suspect or confirmed case will have access to a fit tested N95 mask. And that's very important because an N95 mask needs to be fit tested to that individual so that it works appropriately. And we're hearing alarming reports of how many employers do have you know, N95 masks on the premises, often locked away. But you know, when we dive deeper, we're hearing that no fit testing has been performed. And obviously, once an outbreak is declared or there's positive residents, it's too late because we know how fast you know, this virus can spread. So we're hearing from our members. I can tell you they're very difficult conversations to hear as they describe these types of conditions that they're working in. And it's hard to listen to them. You hear the angst in their voices. They're very emotional. They're worried. They're worried about, you know, not only their safety, but the safety of their residents. You know, they have formed relationships with these residents that they provide care for. These are long-term relationships in many cases. They've known each other for years, and they're seeing these residents die, frankly, at a very alarming rate. And that wears on them. That's very tough for them to do. And they're worried about their own safety, about, you know, getting a positive, catching the virus themselves. And then they're worried about their families, bringing the virus home. There's many stories of staff making alternate living arrangements and you know, not seeing their family because, you know, they're worried about spreading the virus into their home life. So I just, you know, will close with a few comments in saying that yesterday the province released, you know, a comprehensive report on a staffing plan on long-term care. And to their credit, in 4 years, that plan contains some really good things, some good comprehensive things that you know, are much needed to do. They're moving to the 4-hour minimum standard of care that would provide you know, a manageable residents to staff ratio, which is what we've been calling for. But it's 4 years from now, and in 4 years there's going to be a lot more deaths in long-term care, 4 more years of neglect of these residents because of chronic understaffing, and that is unacceptable to us. The government, the Ford government, needs to act now and implement those standards immediately, and it's possible to do because we've seen in BC, they hired and trained and paid healthcare workers and have produced immediately 7,000 healthcare workers to help with the staffing crisis. In Quebec, that number was 10,000. In Ontario, they've got a plan where they'll get there in 4 years, but they've done nothing. All of they've done is offered some temporary pay to try and keep, you know, people motivated to come to work. But, you know, it's not about a $3 premium. It's about having adequate staff of workers being able to go into a workplace and know that they've got a team to do the job right. So, you know, we're calling on the government now to put immediate resources in because the neglect continues to happen. It's horrific. And you know, frankly, there's going to be a lot of unnecessary deaths, and it's government inaction that you know is responsible for most of those. So those are my comments, and I thank you all for being here today to tell this story.
Thank you very much, Andy. And last but not least, Deborah Maxfield is a long-term care worker herself. She's working currently in the homes. In fact, she was called in last night, and she represents. She's the elected leader of the Healthcare Workers Coordinating Committee at CUPE, which represents the healthcare and long-term care workers. Welcome, Deborah.
Thank you. Good morning. CUPE represents about 35,000 staff working in long-term care institutions in Ontario. It's truly an honor to be a part of today's media conference. We're here to shine the spotlight on the very stressful conditions inside Ontario's long-term care facilities for the residents and the staff who care and work in them. Although 2,400 residents have died in long-term care facilities in Ontario, more than 80% of all fatalities conditions are deteriorating rather than improving. Our members are staggered by the loss of hundreds of residents for whom they had formed a deep attachment. Therefore, an ongoing staffing crisis. In fact, staffing levels have never been lower and can be attributed to a number of factors. Ontario's long-term care facilities have one of the lowest staffing levels of any province in Canada before the pandemic even began. The government's policy to restrict staff from working at one home site during the pandemic has meant that many part-time staff had to choose an employer from whom they would work for. As a result, now heightened staffing shortages. The difficulty in securing adequate personal protective equipment has had an impact on deterring some staff from working during the outbreak. What we are experiencing at this time in the workforce, which is totally exhausted from working overtime and extended hours for months on end and suffering emotionally from terrible tolls of that the virus has taken on the people that they care for. There is a study that CUPE has conducted in partnership with researchers from the University of Windsor, nurses and PSWs that we represent in long-term care, reported constantly working 44 of 60 hours, bringing 6 meals to work in grocery bags for consecutive shifts of being exhausted to the point of tears by the ongoing demands for almost over a year providing care to these residents in these awful, awful conditions. Overtime is rampant. It is simply not sustainable that the workforce in long-term care will be able to continue at this pace for very much longer. We are very distressed that in Quebec, concrete steps have been taken to hire 10,000 personal support workers to address the long-term care staffing crisis in that province. And yet Ontario in November 2020 economic statement brought no additional resources to dedicate to increasing staffing levels, even before the pandemic began. Ontario's care for residents in long-term care was insufficient to maintain their well-being. The pandemic has exploded the gaps in care. COVID-19 has exploded the lack of accountability and inspections in long-term care facilities. It has exploited the failure to cohort residents from COVID-19 from those who did not have the virus. It has exploited the failure to transport residents with COVID-19 for treatment. It has exploited the failure to provide appropriate personal protective equipment to staff working in long-term care. The residents in long-term care and staff who provide such loving and devoted care for the demand of the Ontario's for care for them demand that the Ontario's government immediately lay its plans out to hire 25,000 new staff who are needed immediately to stabilize care. Thank you.
Okay, thank you very much, Deborah. So we'll open it up for media for questions and answers. Could you, would you mind putting in the chat just your media outlet, and then Sala will call on you. You don't have to put your question, just so we have a list of who wants to ask questions. And then, and if you wanted to direct it to anyone in particular, that's great. Okay. So I see Jessica Smith from Queen's Park Briefing, and then I'll hand it over to you, Sala, to say. Please go ahead, Jessica. Thank you.
Hi, thanks for taking the question. I saw there's a part of the report where it talked about homes resorting to various physical barriers, such as partition-like barriers. I was just wondering if somebody could explain what that means.
Yeah, Megan?
Yes.
Could we have more of a description of what those actually look like? Like in some homes, what we know and what I've seen is they're using that yellow like caution tape and putting big X's across the doors to try and prevent residents from wandering into and out of rooms. But in some places, they're using actual like vinyl barriers. Do you have a better description than that? I haven't seen them. Or does anyone? I think they're, sorry, go ahead, Megan.
What the staff person described sounded like some sort of half wall barrier that they would put in the doorways and in the hallways. I don't have any more details than that.
And it was made of vinyl, right? That's how they described it. So some kind of vinyl half wall barrier. And then in the other ones, like in multiple homes described this, taking away their wheelchairs and walkers so they just couldn't get out of bed.
Okay, and to follow up, there were some quotes that you got from the survey respondents about like issues such as N95. Do you have any of the like direct quotes about the issues surrounding cohorting the sick residents from the well residents that you could share some of the experiences on that side of things?
Yeah, we can, if you'd like, we can send to you the direct quotes from the surveys themselves. Megan, do you mind pulling them out and just emailing them over to Jessica?
Yeah,
Smith?
absolutely.
Great, thanks. That's what I wanted to ask.
Okay, thank you.
The next question comes from Adam Atkinson of CHCH News. Adam, you may now unmute yourself.
Thanks. About Graceville in Hamilton, I don't know if anyone can talk about this, but what are some of the main issues that staff are seeing there, which is contributing to the deadly outbreak?
Go ahead, Ricardo, yes.
I'll speak to that. Some of the issues our members complain about is they have IV bags that are left on the floors, residents in feces not being cleaned, the staffing shortage is severe in that there's only a few people that are working at a time. They recently got help from, as I stated earlier, from the Hamilton Health Services. But at one point, in terms of keeping the place clean, that was, something that for whatever reason, and it's really, we believe is the shortage of staff, that was not a priority. There's not enough people to give care to residents. So when people in the environmental services are absent, there's really no cleaning that was being done at a certain time.
Now, someone mentioned that it was suspected that there might be something wrong with the ventilation system. Can you go further into that by any chance?
Yes, the members, they feel that the ventilation system, that the virus is traveling through the ventilation system. They were, asking that, the employer have an expert to come in and test the ventilation system, because they couldn't explain for themselves why the hell the virus is spreading so rapidly across the home. So we have reached out there and asked the employer to do that. We don't know if they're going to comply, but this is something that our members believe, that the virus is traveling through the ventilation system.
So we've heard this also, that that home was in chaos, that it was filthy. It was in chaos. It took far too long to get any kind of intervention at all. Like it took, videos of the local MPP almost in tears, watching the bodies being pulled, the dead being moved out of that home. And the workers describe a situation in which the home had fallen into literally chaos, with just dirty, no proper cleaning, just terrible inadequacies in care. And to the point that they themselves are, very traumatized by what has happened there. And that's not just there, it's the same in a number of the other homes where they describe, the hallways just full of garbage. Residents left in feces for 24 hours, feces on the wall, in one home where they, are not able to, they don't have enough staff to dress, or change the residents. So they're left either without clothing or, those sorts of conditions. It is like what the military described back in May, and that the province promised that they would solve. Sorry, I didn't mean to weigh in for too long there.
No, you're absolutely right, Natalie. The members, they gave up. They said, look, on their employer being able to take control of the virus, that they said, look, can the union get the Army to come in and help them? And we wrote a letter to the Minister of Defense on December 11th, asking the government to bring in the Army to assist the home in giving care and cleaning, whatever the military does when they go into the home, that they can provide some kind of help, because the staff, they are overwhelmed. They're not enough staff there to help out. They just need help. They just need help, and they need a break, because they've been working for weeks on end without any days off and working overtime hours.
Thanks, Ricardo.
Adam also asks, are there any pictures from inside Grace Villa or any other homes that you'd be able to share?
That is a tough one. Is there anyone that has or can get? We can ask some of the families. Like, we'd have to ask them not to take pictures of like actual staff or residents, but of the condition of the home. We could ask some of the families. The workers would be fired for sure if they were to do that.
They're not allowed to be using their cell phones while at work. So that is something that people will get disciplined for if they're seen using their cell phone at work, taking pictures and that kind of stuff. So that would be difficult to get, as you said, Natalie. Maybe the family members might be able to take pictures.
So Adam, it would take me a few days, but I will ask the family groups in those homes that we're hearing are sort of have descended into chaos, if anyone is able to take some pictures, and like we can blank out the faces, or we can make sure that there aren't individuals in them.
That'd be great. Thank you very much. I've
Okay.
included my email address in the chat.
Okay, thank you. Megan, can you copy that for me? Thanks.
The next question comes from Emma Paling of the Huffington Post. Emma, you may now unmute yourself.
Hi, everyone. So I have a few questions about the military report and just the scope of that. So obviously the public was really shocked by what was exposed in the military report, but that was only 5 homes. Can anyone give me an idea of how many other homes have had conditions like that this year?
I was going through, like, from the first and the second wave, you mean?
Yeah.
I was going through to try and figure out, how many really have been terrible in this out of the 626 homes. And I got to 100 and I had to stop. But I think between the first and the second wave, we're looking at, somewhere between like around a sixth of them at least that we know of, right? Where we have heard of these types of conditions, like really horrific conditions, incompetent managements, or things that have just spiraled out of control. And I can actually, after this, sit down and just count through the full list. It'll take me about an hour and I can get back to you with a more concrete number.
That's really helpful, even just to have that ballpark. And then I just wanted to ask for anyone who wants to comment on this, what would you say to members of the public who watched the Premier's press conference that day after the military report came out and thought, he looks really concerned, he sounds really sincere, he'll take care of it?
Sorry, Emma, I should just say that doesn't mean that like there's 100 homes with, more than 100 people infected and so on, but like at least 100 homes in which conditions, access to PPE, dirtiness, inability to get clean sheets, inability to feed or change residents, etc., is happening, right?
Okay. Yeah.
So sorry, your question was about Doug Ford and sorry.
Yeah. So what would you say to members of the public who saw his comments that day after the military report came out and thought he sounded really sincere and, he would take care of these issues and improve things?
Andy?
Yeah, I would say, and I'm going to be very frank here. I think what we learned is talk is cheap because, we highlighted for his government, we, prior to the pandemic, we met with Fullerton, the Minister of Health Long-Term Care, and provided her with a comprehensive report that we commissioned the Ontario Health Coalition to do because it would be seen as non-biased. And the report stems from community roundtables where employers, educators, advocates, politicians, unions, all brought together and produced a very comprehensive report that we gave to the Minister of Long-Term Care and that we handed to Premier Ford. So he knew going into the pandemic that there was a crisis, and he knew that it was going to get worse. To the degree that it did, I think possibly they never knew it would quite get that bad. But the military report highlights, unspeakable conditions. And frankly, those unspeakable conditions continue today. So I guess I would say to the Premier, you can act as upset as you want. You can try and, make it appear like you're being sincere when you talk about what's happening in long-term care facilities, but he's got an opportunity now to fix it. And what he's done with that opportunity is put it off for 4 years. So again, we're going to have to see what happens over the next 4 years in these facilities and hold the province accountable for their inaction.
If I can just add, because I'm furious. The families are furious. They talk about Premier Ford and his crocodile tears. They talk about all the promises. Right after the military report, Premier Ford promised that there'd be accountability. He promised that there would be inspections. He promised that they would address this. He acted like he cared, and nothing substantive has happened. And in that staffing, the comprehensive staffing report that they put out yesterday, as we're hearing of home after home after home, where the numbers are exploding, where they're falling into chaos, where the staff are getting sick in by the scores, and care is falling apart, that they are going to provide the first segment of that 4 hours of minimum care. The first segment of it is not to be done until not this April coming up, but the April afterwards. I could not believe it. When I read that report, the families, our email, our Facebook, my phone lit up. People are furious and they're calling him out. They have lied to us. They have promised to do things. They have done nothing substantive at all. And in fact, if anything, the staffing is worse now than it was after the first wave. We're losing staff all the time. And I think the people here can verify that I'm not making this up. Staff are leaving, they're getting sick, they're not able to sustain this kind of work environment for good reason, and it's getting worse. And there's just it's like the government is completely deaf to what's going on in the homes. It's horrible. Sorry.
The next question comes from Doug Dejak of TB Newswatch. Doug, you may now unmute yourself.
Thanks for taking my question. This would probably be best answered by Andy Savala. I'm just curious to know if the responses from staff at Roseview, or Southbridge Roseview here in Thunder Bay, it's one of the only homes here that's had an outbreak of this size, are consistent with the results that you're seeing in this survey. If you don't have that kind of breakdown, maybe just what are some of the stories you are hearing from staff at that facility in Thunder Bay?
So I don't have the numeric particulars, but I can tell you that, first of all, I watched a piece on TVT News last night where you featured a family member talk about these exact conditions and talk about the fact that if they didn't have a person to go into that home to keep their loved one hydrated and fed, I think what she said is they were convinced that that person wouldn't be alive today. So the conditions in Roseview are comparable to everything that we're talking about today. Some of the comments I made are from, the stories that we've heard out of Roseview Manor with empty hallways and no staff available. Lots of times, the only person you interact with, if you're a family caregiver, is a security guard who will direct you or even walk you to the residence room. So Roseview Manor is in terrible condition. I know the cases are starting, to decrease, thank God, but certainly it's as horrific as anything that's been described by the military that we're talking about today.
We have no limit on questions. Please don't feel like you can't ask what you need to ask. And Andy, are there any specifics, is that there's not enough sort of housekeeping? I know they had agency staff going in from Toronto to that home, and are there any sort of specifics about the conditions in the home around there's not enough staff, but is cleaning happening? Are people being fed? Are the meals really delayed? Anything like that you're hearing that's sort of can give a kind of a fleshed out picture?
Unfortunately, I'd have to say that all of the things you just spoke of, Natalie, are happening. I mean, we're hearing of residences, food trays untouched because if somebody's had the time to drop it off, nobody's had the time to help assist the resident in feeding themselves because frankly, there's no staffing. We're hearing, they're really stretched in terms of having staff to clean and sanitize the facility. I'm going to be honest and tell you personally, I heard from a cousin of mine. My aunt passed away about 2 nights ago in Roseview Manor, and the reality is that he described everything that we're talking about today. And I don't think until you experience it personally, it really affects you in a way that it can or it does. But certainly, it's a very tough situation at Roseview. I don't know why the hospital hasn't gone in. The Thunder Bay Regional Hospital hasn't gone in and provided, the much needed resources, because that should have happened. Frankly, it might have, prevented some deaths and that type of thing. But the situation in Roseview is very, very concerning.
And I should just clarify, because it's on the minister to make management orders or management agreements. So they've gone for mostly management agreements, and we don't know what's in those. They vary. But the management orders to take over the homes that are out of control, the minister has the power to do that, and we think should do that. And if the hospitals don't have the capacity to do it because they themselves are overstretched, we're supporting what SEIU is saying. We're saying, the numbers are the same point in this wave that we were in the first wave when the military was called in. The situation is the same, it's materially the same. And we support, if there aren't resources in the local public hospitals to do it, then, they have to get care into the homes. Okay, sorry, Salah, you wanna?
Yeah, Adam. Doug has a quick follow-up question for Andy. Are other homes, even though not experiencing an outbreak of COVID-19, experiencing similar issues as those outlined in the report?
I would say yes. And I would say maybe not to quite the same degree, but in all honesty, these conditions were the conditions that, were happening prior to the pandemic. Again, in the comprehensive report I spoke of, we talked about these types of things occurring. We talked about people not getting the care that they deserved and the concerns around those things. But I would tell you that all of these conditions, exist right now in long-term care facilities right across the province. And again, the Premier's acknowledged this. He's acknowledged that, the situation was not good prior to the pandemic. He said he was going to fix long-term care. And so, we're challenging him to do it now. We don't understand why you can't put the resources in place, that are much needed. Put the 4-hour minimum standard care in place now, and you can adjust those numbers as needed accordingly as you gauge what the effect that they've had. But and the short answer to your question is there's horrible conditions in every, and again, it's worse in the for-profits, but the situation's not good, I would say, in the majority of long-term care facilities in the province of Ontario.
Okay, Adam, you said you had another question. Please go ahead.
Yeah, thanks. Back to Grace Villa for a second. What exactly is Hamilton Health Sciences staff doing at that facility?
So they have sent approximately 20 registered staff to help out. They are providing help, but at the end of the day, what the members are asking for is PSW. PSW to actually help them to do the daily routine, the daily type of care that they give to the residents. It's nice, and they appreciate having registered staff, RPNs and RNs to assist. But what they are asking for is PSW to help them feed residents, bathe residents, get residents out of bed, that kind of stuff. What is happening with the registered staff, they give medication and that kind of stuff, and other work that they do, but the hands-on care, the actual hands-on care, the PSW are asking for more PSW so that the residents can get out of bed, they can eat, they can get dressed, etc.
It was officially announced earlier this week that Hamilton Health Sciences was taking over the running of that facility, but they've actually had staff at the facility for a couple of weeks now, haven't they?
They have had some staff, a few registered staff, not many, a few registered staff, and even during the time that they assisted by providing a few registered staff, the workers there have been crying out that they need more help. They need PSW. They need folks in the dietary department. They need people to clean, that kind of stuff. And they have not been having that. Now that Hamilton Healthcare Service has taken over. It's really recent. We're hoping that things will improve in that home, but it is yet to see. We'll find out in due time.
Thank you very much.
Thanks, Adam. Are there any other questions? Okay, so I think we covered it. Okay, well, listen, thank you very, very much for joining us. Thanks for telling this story and bringing to the public what's happening in the long-term care homes. We really, really appreciate it. And thank you to all of the speakers for being here and for helping us with this survey with your members. We appreciate it. Okay, have a good day. Please stay safe.